My name is Tim Maria, host of Informed Health 2015. Good to have Adam Gazzaley, Dr. Adam Gazzaley here. I think I saw you last down at Exponential Medicine.
Yep, I gave a talk down there earlier, late last year.
And I'm excited to finally be up at UCSF and to take a look at your lab. So for folks who don't know about you, tell us about your background.
I'm trained as both a neurologist and a neuroscientist. My most recent goals of my lab are to see if we can integrate modern technology, particularly video game technology, but also different sensors and devices, and validate them as health and learning tools.
Cool. So there's a lot of innovation at the CES, International CES last week, coming out. Did you see anything in particular you'd like to get your hands on for the lab?
I'm pretty excited about virtual reality. I know that had a big presence at CES. We're now experimenting with multiple headsets, both from Sony and Oculus, and we're interested in now doing some full body motion during it. We already use the Kinect 2 in several of our experiments as motion capture device, and the idea of potentially using like the Omni so people can walk into a virtual reality environment is really appealing to us.
Yeah, the Omni, I want to thank to the team at Omni at CES because it was a great experience. And for $600, it's amazing they could even make it for that amount of money. So you were here on stage at the event. What topics were you discussing?
I was just giving a really broad overview of what our lab does in terms of technology and neuroscience. So I did a quick fly through of 4 new video games that we developed that act on different aspects of cognition. We've completed them, or almost completed them, and are just about ready to begin research studies to understand what impact they have on how the brain functions and other aspects of cognition and mood and stress and sleep. So, this is the stepwise process that we go through when we first develop something and then validate it as carefully as we can.
So is your goal to commercialize a product or service or software in the future?
Eventually, we want to see the things that we create and study impact people's lives. So we want to have it get out of the lab. The route to do that is complicated, of course, and there's many different ways. You could think about these as medical tools where they're therapeutics and diagnostics, and then getting FDA approval for them would be really important. You could think about them as education, consumer, for military, high performance folks like athletes. So there's many different pathways, and we're still trying to figure out the best way to move to commercialization. But the first step is to be very rigorous about our science and put out publications that the field trusts.
Yeah, and we're finally getting there. The Samsung Gear VR launched. Sony looks like they're coming out with their headset. Oculus is coming out this year. So it seems like 2015 is the year of VR. What would you say?
Maybe 2016. We'll see. I think maybe 2016. But we're excited that we have the ear of those companies, and we're developing alongside of them. And even if their higher goals are video game and consumer, they're open to allowing us to pursue science and health outcomes. So we're fine, with the time it takes for this to develop, because we have our own time scale that takes a while. Yeah,
we should say hi to our friends at Samsung and Oculus. Thanks for sending the Gear VR out. We had fun with that at mHealth Summit. And so what's next for you coming up for 2015?
2015 is a big year of research for us. 2014 was a lot of development. We built all these new games. We work with professionals in multiple industries to create tools that we're excited about testing. 2015, we go back to doing what our core is, which is careful neuroscience research studies. So that's what we have a lot in store for us this year.
All right, well, good to see you again. Thanks for taking your time and being on the show. Cheers.
Thank you again. Thank you.